I'm happy to introduce our next two speakers. We have a 2-for-1 deal with this next talk. Is Dr. Maria Lapid and Dr. Simon Kung, who is our psychiatry power team. Dr. Lapid is one of our geriatric psychiatrists, and between the two of them, they've really helped us really understand the most up-to-date medical and technical aspects of depression management. So I'm happy to have you both here today, and we'll go ahead and get started.
Well, good afternoon, everyone. I'm Maria Lapid, and I'm a geriatric psychiatrist, and I'm also trained in hospice and palliative medicine. So I'm part of the palliative medicine faculty, and I'm also one of the medical directors for Mayo Clinic Hospice. But today we're really going to talk about late life depression or geriatric depression. So I don't have any disclosures, except Dr. Kang will talk a little bit about some of the medications that may be used off-label. And we're going to talk about screening, diagnosing, and more importantly, treating depressive disorders in elderly adults. So this is kind of the format, and we'll start with the prevalence of geriatric depression. And so we know that the depression is very common. In general, it's a public health problem, and in the same way, it's a public health problem in the geriatric population as well. The prevalence ranges from 1 to 20%. We know it increases with age. We know that depression is more common in patients who are hospitalized, and it's also common in people who are in long-term care settings, especially the nursing homes. And why do we care about geriatric depression? Well, we do because depression is associated with a lot of disability, right? A lot of poor quality of life. It can lead to other problems like more medical comorbidities, more poor outcomes. It can lead to alcoholism. It can lead to suicide. So there's a lot of bad effects of depression. So there's other variants of depression that I listed there. They're called many different terms, but they're all really similar. But you'll hear minor depression, subsyndromal, subthreshold, subclinical depression. So the CDC periodically conducts phone surveys, and they call people at home and they survey people about different health-related measures. And one of the measures that they survey about is depression. So they use the PHQ-9, and we'll go over the PHQ-9 shortly. But the PHQ-9 really asks about the 9 symptoms.